Minutes to the ranking member for her 5 minutes of questioning.
Thank you, Mr. Chairman. I want to start by expressing appreciation for the extra oversight that HERSA has conducted here. Because of that work, we have some tangible findings and clear recommendations for process improvements. I'd like to talk through HERSA's process in investigating the Kentucky case. Dr. Lynch, has HERSA ever directed the OPTN to initiate an investigation like it did last October regarding the Kentucky Organ Procurement Organization?
I should clarify, Madam Ranking Member, that this occurred before my time at HERSA started in October, but to my knowledge, I am unaware of any such direction.
Okay, so what has enabled HERSA to direct OPTN to carry out more stringent oversight while also conducting its own parallel analysis?
To be frank, it's the Securing the U.S. OPTN Act. It's the authority that Congress gave us, the ability to hire in expertise and to stand up a data and analysis team to make sure that we can study these problems with the appropriate degree of rigor.
So why did HERSA determine that this level of oversight was necessary over the Kentucky Organ Procurement Organization?
So the initial decision, again, preceded my individual time at HERSA, but it was a relatively easy decision to identify this. On probing, the OPTN contractor had sent a letter to the OPO asking for a detailed list of information. They got back a one-page letter telling them that there was no problem and that the OPO was satisfied and confident in the process that this patient had undergone. The OPTN and its contractor then elected to close the case. Closing the case without reviewing the documents that you asked for is so inconceivable in a safety investigation that made HERSA reassess this.
Very well. The OPTN Board of Directors is also responsible for enforcing its policies among OPTN members, which include OPOs and transplant hospitals. Dr. Lynch, how does HERSA envision the role of the new OPTN board in conducting oversight, and what changes should it make from the way things were handled previously?
So the vision for the OPTN is to provide that system-level oversight. And to be clear, HERSA and other agencies within HHS provide parallel lines of support and oversight for elements of this community. HERSA is the system. By the OPTN, we're able to manage the elements that are within the transplant ecosystem, so to speak. The vision for this is that every patient who is touched by a member of the OPTN system should have their information knowable, and their experiences, good or bad, should be the basis for subsequent policy making and policy improvements.
The findings of the report are deeply concerning, and it's astonishing that no one appears to have thoroughly examined what happened in Kentucky for several years. The incident, including T.J. Hoover, occurred in 2021, but there was no report of the case until 2024. Stronger oversight protocols of the OPTN and more transparency from OPOs would uncover patient safety issues more quickly, enabling more timely improvements. Dr. Lynch, how does HERSA plan to increase oversight of OPOs specifically and improve visibility into outcomes for pre-donors, as you mentioned in your testimony?
So it is a multi-layered approach to this. The first is knowing the data that every patient who's interacted with will have their information known to the government. That's something called a ventilated patient form in the case of the OPOs that we will know from the time of referral and first contact through either the successful recovery of organs or the end of the OPO's contact with that patient. And then in the case where something adverse happens, HERSA has already changed its practice so that instead of the report going to the OPTN contractor and being triaged there, reports can now come directly to the government for assessment and direction to the appropriate entities.
So what triggers that when it comes directly to HERSA, or is it that it goes to both?
So there are two ways in which a safety event can be reported. One is that it can be reported by the OPTN member itself through their secure portal. A broader way to do it is that anybody involved, anybody with access to the internet, can go to a public-facing website and make a report to HERSA.
Very well. Are there currently other HERSA-led investigations underway that you're able to discuss?
I would prefer not to discuss them in this setting, but there are investigations ongoing.
And how does the Kentucky OPO investigation process inform HERSA will approach its oversight and authority going forward?
So the corrective action plan that HERSA released on May 28th is the first of its kind. This has parallels within other entities within HHS and the rest of the federal government. This is meant to immediately mitigate the circumstance at this OPO. But there's also a broader part to it. Part B addresses the entire system, and we are confident that this pattern of care can be prevented in other OPOs.
Very well, Mr. Chairman, I yield back.
The gentlelady yields. The chair recognizes the chairman of the committee, Mr.